Hey, everybody, welcome back to another episode of Tactical Scrubs. It's Mel, your host, and I am so excited to be here today with Miss Carolyn Ramsey-Hamilton, who, not for nothing, but I'm having a fan moment. I think she is awesome. She's like one of the OGs in women in security, and I'm really excited to have her here today. So thank you so much, Caroline, for taking the time out of your very busy schedule to talk to someone like me.
I'm thrilled. You're one of my heroes too, and I'm just thrilled to meet you in person after talking online and LinkedIn for all this time.
Oh, well, that's such a pleasure. Thank you so much. I'm really excited. So tell us a little bit about, your journey in security, like how you got started, because I have a lot of listeners that really don't know anything about security. They're on the clinical side. And I think that, for me, finding people that have a wealth of expertise has been so valuable. And that's kind of how I've reached out to you. So tell us kind of where you got your start and where you're at now in the industry.
Okay, so I got my start. I lived in Southern California for years. That's where I grew up, and I graduated from University of California with a degree in cultural anthropology, which is it turned out to be really good for marketing and things like that. How
I was
people
going to say, how do I get a degree in that? That sounds awesome.
And it's a lot of fun too. I got to tell you, I'm just trying to think about the sequence of events here, about what happened next. Oh yeah, I got a call from a company out in near Palm Springs, California, and needed somebody to do some things for them. And I went out there and I didn't even know not to wear I wore like a party dress and high heels and all this stuff. I didn't even know how to dress for my interview and all this stuff. They hired me anyway, I guess, because it was sort of the talent pool out there wasn't so great. I went out there and it turned out the guy that I was working for had worked for a big ad agency in New York City. And his company had just bought this place where I was working. And that's how he found me. I was their marketing director. And so the guy took me back to New York City and taught me everything I knew from all these big ad agencies.
Wow, that's so
Yeah,
cool.
it's a lot. I have a million stories, but this is going to be short. Or just tell me to stop. But
No, you're great. I
I
want to
was,
hear every bit.
thank you. So the next thing that happened was I started doing political campaigns, right? Because I was doing a lot of marketing and stuff. And so naturally people want to run for mayor of Palm Springs. And somehow, and I had been doing local campaigns, like mayor, city council, things like that. And
Right,
all of a
right.
sudden I got a call on the phone from Sonny Bono, if you know who that is.
Yeah, yeah.
And he had heard about me someplace, and he owned a restaurant in Palm Springs called Bono's. And he said, I've heard really good things about you, and I want you to come out here and talk and meet me. So I lived actually in Riverside at the time. I drove out there, an hour out there, and sat down and talked to him. And he basically hired me on the spot to run his campaign for mayor of Palm Springs because they had just raised his taxes. And he was so angry about it. And so I went back to my office and I did a couple of calculations. First, I looked at like how long the current mayor had been there, 30 years, and then
Mm-hmm.
looked at how long Sonny Bono had been, how many people knew he was even running, and it was 90%. I knew we were going to win at that point.
Yeah, yeah, for sure, with 90%.
Yeah, and I have really good statistical background. So I did his campaign, stayed in touch with him, and after that, I got a call for another political campaign. So I went there, and there was this crazy guy there who was really smart. And he was an IT guy. This was like in the first days of IT when people still had an IBM XT on their desk. And he called me on the phone after I met him. He was a professor, but he didn't know anything about how to write or anything. And he goes, I developed this security software and I need help writing like instructions on how to use the user manual and all that kind of stuff. So I started working with him, moved in with him. Boom, now moved to Washington, D.C. from Riverside, California.
Okay,
And
okay.
and
That's a big jump. That's a
that
big
was a
jump. How was that? How was that weather change? You're like, oh yeah, it gets kind of chilly here in the winter.
I was okay because I lived up in the mountains, but the first day I went to Washington and got off the plane at Dulles Airport, there was like 3 inches of snow on the ground.
Oh my
And
gosh.
I
Yeah,
thought, oh my God,
I don't miss the snow. I'm
it was,
definitely happy as a Texas girl.
yeah, I'll bet you are. I love San Antonio anyway, but
Mhm.
so he got me, he also couldn't write, do all this stuff. So I started doing all this stuff. And then I had to talk to people about it. And meanwhile, he's teaching me everything about IT and computers and all that stuff. And pretty soon I was there 2 months and I got put on an NSA committee to write risk management guidelines for the government.
That's incredible. And I think that's so important is like, women do have different skill sets as far as just like organization and putting things together and a different type of thinking that I think really adds value to a lot of organizations and
And I
especially at
think,
that high level.
yeah, and I think women are more collaborative too, you know. We're not the
Right.
ones who are out there trying to hog all the attention, you know.
Exactly.
And we're
Exactly.
willing, I mean, we want to actually get the work done. So we want to meet other people. So I met everybody. I mean, I met everybody from all over the world and we traveled all over the world and started to do because had developed assessment software. And as soon
Mhm.
as I started playing around with it, I could see where it didn't work.
Right. Right.
So pretty soon I was doing assessments using that system for doing training. And, it was just great. Met everybody. Then I was in IT security for years. And then I started doing larger buildings, like the FBI built I think that was one of my first biggest project was they decided to move their criminal justice system out to West Virginia, to Martinsburg, West Virginia.
Okay, beautiful area out there. I love Martinsburg. I used to go
Oh,
to
you
school
have?
out there. Yeah, I went to school right there in the Maryland, the DMV area, right where that in Fredericksburg,
Yep.
Hagerstown area.
Yep, I love that area. It helped at that time, IT's just waking up, right? People are using
Right, right.
faxes. So there's all these faxes going back and forth. And that means that somebody in Salt Lake City arrests somebody and they want to see his profile. So they fax a request to Washington, D.C. to the J. Edgar Hoover building and they fax the response back. So it's taken
That's so,
forever.
for a lot of nurses now, like we used to have to fax pharmacy prescriptions. So, like the
Yes.
doctor would write the order and then you would fax it down to the pharmacy. The pharmacist would read the order. I think it's so funny when we have like a technology interruption, especially like a cyber attack, where people
Yes.
now the network's off and these nurses have no idea even how to like write the order so that it can be faxed over the internet. They're just so confused about how to do that.
That's right. And so there was all of a sudden their data centers, nobody even knew what a data center was. And they didn't even think to lock the doors. And I went in there one day and I thought, this is insane, to have the Department of Veterans Affairs or the FBI not even locking the front doors because
Right? They
they
just
never,
assume,
yeah,
they're like,
yeah,
nobody will
they,
mess with us.
and especially with the data center too. One of the funny ideas about data centers in Washington, D.C. was everybody, when they first came in with all this computer equipment, they thought we'll put them in the basement because that way they'll be absolutely safe, almost underground. And I went to so many data centers where the alarm went off in the middle of the night on the weekend and it flooded the data center. All the sprinklers went on, right? Ruined all the computer equipment. And I would walk down this, yeah, I walked down the stairs in the morning and it was like, it, I think it was a Veterans Affairs. It looked like a blue lake. I mean, the water was crystal clear, bright blue, and it covered the whole room.
My gosh, what a nightmare. I mean, I think it's like you never know. And I think that's the portion of security that I like, I enjoy, because I'm not from the industry, right? I'm from, clinical side of things. And that's what I loved about the ICU was you never knew what was going to roll through the trauma doors or you never
That's
knew what was
right.
going to come in that day. And I think that's something that when we look at security, and especially when I look at helping organizations to determine who to hire for their security departments, I think that's really important is and of course, as we source our vets through the funnel, there's things that I ask them like, do you like the challenge of having something pop up at work? Are you a routine type of person? Because I think those people are generally a little bit more observant and they're also great problem solvers. And it sounds like you've had tons of that experience with, building solutions on the fly for these large organizations.
That's right. And so I had identified that as a problem, and people kept calling me and asking me about safeguarding their facilities and their communications and all this kind of stuff. So I sort of got out of and by that time, most places had decent IT practices in place. They're following the NIST guidelines and everything. I was also on the NIST committee to write all their early requirements on risk assessment security. So I sort of migrated over to the facility side, which was huge because, the giant buildings everywhere and so I just kept on going and people would hear about me and they'd call me up from Germany or Sweden or someplace and I'd just get on a plane and go over there. It was unbelievable. And in fact, I did one in Bangkok for a big another security company that didn't have the expertise I had. And they called me and left me a message on my voicemail. They said, just, deposited, $20,000 to your account. And we got a plane that's leaving for Bangkok tomorrow morning from LAX at 8 o'clock, and we need you to be on it.
I'm sorry, but how do I get to that level of status? Okay, Carolyn, like this is like, give me all the tools. Tell me what what your routine looks like daily, because every person needs to get to that level. And I think that's one of the reasons that, like for me and what we're trying to do and our mission, it is in alignment. We truly identify, like you said, there just needs to be somebody that gets the work done. So
And
you've spent all these years consulting and you've done these huge projects. And I think, that's the type of people that are going to actually make a difference in the future of this nation.
well, I do too. And I also think, what this just points out, because one of the things that has happened in this evolution, especially in hospitals, was 2013. I got a notice and it said that they were coming out with guidelines, right? CMS, the Centers for Medicaid and Medicare, after Katrina, which I also went to New Orleans and worked on.
Yeah, that was what a
As a
mess.
first responder. Yeah, that was something. And so I get this notice from CMS that they're now have guidelines for emergency management. Much to my surprise, what's the first thing they have to do before they write their emergency plan? They have to do a security risk assessment, or what they called an all hazards risk assessment.
Right.
It looks at it. I mean, who thought that a hospital would be engulfed in a lake, in Katrina?
Right.
But that's what happened. And that's why they called it all hazards assessment, because you look at everything that could possibly go wrong, which is almost anything, and you go from there. So that's when I started really working with hospitals directly. And I've worked with probably about 1,000 hospitals all over the country. And then I've even done like in Saudi Arabia, I did a hospital in Abu Dhabi, because once the U.S. passes those kind of compliance regulations on what you have to have, and that you have to have this risk assessment at the head of it, then all around the world they pick up the same requirements. I even Argentina, unbelievable.
Yeah, and I think that's one of the things that's been shocking to me is like we are arguably one of the best funded, best organized countries in the world. And people obviously at the rate that they're trying to get into this country, it's understandable, but I think that one of the things I noticed in going to England and just traveling around this past year and spending 2024 kind of looking at all the different models is like we really do lag behind on the healthcare side of any type of industry standards or any type of real support from the security side, not from, necessarily individuals or associations. I think that they've done what they can do with what limits they have to operate in. But I think one of the things that I've seen to be a major challenge has been like the adoption of the actual, like, what are the standards? What are the things that we need to look at to make sure that we are meeting the needs of our employees, number one. And then number two is our patients. And I think that that's the gap that has really been lacking and that's what I love about you and the approach that you have with your threat and risk assessments is that you're looking at the human dynamic. And I think that's the portion of healthcare business or healthcare security that's really missing is, what is the asset? And I always say the asset is the relationship that exists between the patient and the provider, the patient and the caregiver, whether you're looking at that provider as the whole system or just one nurse to a patient, right?
Yep. Well, just take yesterday, for example, how these things all come up. Like when I started with this, I didn't even know what workplace violence was, because they didn't have workplace violence, or they hid it and they didn't tell you about it, or they didn't warn you, or no. Again, this gets back to the requirements, compliance requirements, is hospitals are not giant money-making establishments. They are not going to spend money on something. People tell me this all the time. Is it a requirement? Yeah, it's a requirement. If you don't if you don't do this, then you're not going to get reimbursed for your Medicare expenses, which are 70% of your revenue at this
Right.
hospital
Right.
or hospice or whatever it is, ambulatory surgery center. So you have to do it. And that's the thing. It has to become a real requirement, especially a federal or state requirement.
And I think that that's where having experts like you to come in and say, here, these are the things that actually do work and we should require them. Vendors or other people coming up and being like, oh, this is a great idea. Let's make the entire state buy it, when we show that, the evidence doesn't support that. And I think that was the goal of me creating an organization where we put the evidence first. Like, who are the best people that can come to the table and say, hey, this is what we think works really well, and I've seen it work well here. I've seen it not work well here. And what can we offer organizations so that they can have the resources, because they don't have a ton of overhead. They aren't generally for-profit organizations. I mean, they are. Like, let's have an honest conversation about that. I think the way that organizations are funded and the way that insurances and big pharma and everybody's kind of in this revenue cycle together, it's all really, really, really complex. And there's a reason for that, and I think we have to, though, no matter what the complexity is, we have to have an approach that works. And I think that's one of the portions of having excellent people on the team like yourself that can do the threat assessments, the risk assessments, and really do have a wealth of information from all around the globe.
And just to show you how prevalent the workplace violence is, I mean, yesterday, one of the things I do for fun on the weekends is I write my risk alerts, which are encapsulated.
We need to get you do you like to paint or something? You're
No, no,
you're
no.
like me. You're like me. This is what I did for fun over the weekend. Everyone's like, Mel, that doesn't sound like any fun. I was like, oh, it was great. It was really good.
Yeah, but it was because I was writing about Providence Hospital, and they had they had a patient attack two people in the emergency department, stabbed the physician, 57 years old, right in the heart, stabbed him like 14 times. He had to be airlifted to another hospital. And the physician's assistant also got attacked. And that was like Monday. That happened Monday.
Right, right. That's on.
There was another one yesterday, and people get killed. Those two people haven't died yet, but this happens like every single day. So one of the things that I try to do, just like you do, is I'm looking for new solutions. So when somebody came to me and said, well, we have this great solution, and what they do is, because everybody's worried about active shooter now, right? You don't want the active shooter in your emergency department. Somebody just walks in with a gun. And again, I think probably 60% of, maybe 40% of hospitals still don't check and have some kind of screening system for people walking in.
I would say it's more like 80% of hospitals don't have a screening system.
Okay, that's even worse. Yeah. And so people are able to, I remember 1 year ago in Memphis where a doctor got hurt and had to go to the emergency room, and they went to take blood from him, and he pulled a Bowie knife out of his coat and stabbed the nurse.
Yeah, I mean, that's why I think, and that's where it's like there's so many innovative solutions for this stuff, and there's so much that can be done with risk and threat assessment, but nobody's translating those skills into the clinical skills, and they're just relying on maybe one security officer for 400 people to try and manage that. And that's not appropriate. It has to be a system-wide approach. And then you get the staff that are, in front of these patients every day involved in that process. And I think that's a portion that people just aren't really, really touching in the industry. Like, what are the things that we can learn from someone like Carolyn Ramsey or someone like Paul Sarnisi or someone like that is an expert in this arena to be able to translate over to frontline staff to save their lives for the day,
And one thing that they can use is you could teach situational awareness to people. So I think, like teachers, I go to schools and teachers say, well, we don't want to hear this stuff. That's not my job to do security. My job is just to teach kids. I'm not supposed to be looking out of the corner of my eye to somebody's bringing a gun to class. Hey, I've been to classrooms where people I was there the day, one of the questions you wrote me was, what security experience have you had? Well, how about I was at Parkland when they had their horrible attack, I mean, I was there that day.
You were there that day?
Yes, I was there that day because I only lived half a mile away, and I had gone out and done a risk assessment in the morning, came back, noticed when I was driving back to my house that there were all the major thoroughfares had all the traffic going south to north. I mean, ambulances, fire engine, everything, 5 helicopters overhead. So instead of stopping at my house, I kept on going right up to the school. And here's now that in an hour, they had set up all these umbrellas outside and antennas for all the news organizations. They had CNN, they had ABC, they had NBC, they had everybody right there. It was the whole thing was just covered with media on the outside, the perimeter of the high school. The event was still going on inside the high school.
You know what? That's one of the things that I've seen, right? So is like as they develop the risk protocols, I think that everybody has these risk assessment things, but then they don't have any protocols to like actually apply them. And then it just ends up chaos. Like we know something's going on, but what is the actual response protocol? How do we actually deal with this? And that's where I think, having people at the table that are experts in every portion of this that we need to touch is really important because you were there and we still are having, I mean, years later, we had the same problem with Uvalde, still going on inside because people cannot communicate to one another. And in the medical field, the number one reason that a medical error occurs is because of a lack of communication or improper communication. So it's
That's
like,
right.
we have all this technology that exists now. You mentioned that you worked with a technology startup a long time ago when technology was sort of just coming out. And I think now that things are getting smarter and things are moving faster, and instead of having so much competition in the market, I would really like to see the market focus on a viable solution from start to finish. And I think that's what we're trying to achieve at Tact Book, right? You think about the phone book of resources and how they all talk to each other. And is there a format that I can bring in? For instance, like I can't afford to, put a weapons detection system at the door, but maybe my triage nurses get Bite Pro and slash proof clothing so they can put that on. So if a knife is brandished, they've at least got some chance to make sure that their vital organs aren't punctured. And if we develop a risk assessment and threat assessments that match the fact that, this patient, like that doctor, this patient is getting really upset. He's showing behavioral anomalies, and I'm trained to look at those behavioral anomalies from a clinical perspective as well as a psychological and behavioral threat assessment way. Then I can say, okay, you know what, if that patient's here, we probably should put the Vite Pro on. Or, he just walked back through the desk, like, let's go ahead and have a protocol response for us to be able to prevent this stuff from happening.
That's right. That's exactly right. And I'm working now with another startup too that has a great solution for these active shooters because all these cameras, there's all these intrusion detection devices to say, oh, there's a gun. The camera
Right,
identifies the
right.
gun and notifies. So what are you going to do then? Just like Uvalde that you mentioned, 376 law enforcement officers outside a classroom and the kids are getting shot inside the classroom and nobody will open the door. I like to think that, I would go in, even if I knew I was going to get shot, I would go in
Well,
and,
that's what happened. The border patrol guy was like, F this, my kids are in there. And he went in. I mean, like, that's honestly, and I think it's like people have to be empowered to do their jobs. And that's one of the things that I've seen with the police department's issues. And in the UK, the police department has really been, for lack of better terms, handcuffed on, about, what they're allowed to do as officers and on the ground. And so it's really degraded the ability of policing to do their job. And they're about 10 to 15 years, I would say, ahead of our mental health response units. And that's one of the things that we definitely need in this country is more diagnoses capabilities, more assessment capabilities, and then the resources. But we also need to not overburden police departments with making them the assessors of this. This is not their role.
no, they're supposed to grab the guy who did it and get him to in
Make the scene
court.
safe, assess the threat, and if the threat needs to be mitigated, they mitigate the threat and then pass off to clinicians who are able to care for the people behind these challenging behaviors. And I think that's true in schools. It's true in, just the regular community portion. And I think that's where it's important to have people with your wealth of knowledge and experience come in and give us the necessary support to be able to say, hey, let's look in this direction, or stop barking up that tree because you're wasting time, money, and resources when we've got kids and people out there every day getting assaulted.
Yep. And it's just amazing. The other thing, it really made me a big believer in education.
Right.
kids need to learn about this. I hear all the complaints about active shooter this, active shooter that. Shouldn't expose our kids. Yes, you should, because my grandchildren are experts in all this. In fact, I took them out for pizza the night of Parkland, and it was February, Valentine's Day, right? 2018. And I asked them, I said, what happened that day when you were, because they were at that time in the elementary school right across the street from Marjorie Stoneman Douglas High School. They were right there. And I said,
Wow.
what happened? And Maya said, well, they came in and they said the police would be here shortly, but kids were crying and they were hiding under their desk. And she said, I told them the police are going to be here in less than 10 minutes. I said, how did you know that? She goes, we listen to you practicing your webinars every weekend, right? Because I was a designated babysitter.
Okay, okay. My gosh.
They actually learned everything I said.
Well, and I think that's the thing. Like
And that's why they weren't scared, because they had knowledge. They knew what to do.
That's what I say. And, organizations all the time, especially the universities. So like if we talk about healthcare and reducing violence in healthcare, I always say like it has to start with the people that we're bringing into the profession. We have to shift the culture from the very beginning. And a lot of people tell me, well, Mel, they won't finish school if they know the violence is there. I'm like, they'll finish school. I said, you have to prepare them for the environment that they're going into. And that means all of the pieces of the environment. And if you do it properly, in fact, they will be able to manage and mitigate behavior way better than your current employees because they'll come off with training.
Yeah, and they'll feel good about it because it's empowering. I just saw the way she said when she's saying this stuff, she felt in control. These other kids are crying and hiding under their desk. And she's telling them what's going to happen next.
Yep. And I think that's key. That's really key.
It is.
When you have a situation is people being able to, and they always, the answer that I always get, as I shared with you, when we first talked, was everybody told me, oh, well, you can never possibly standardize a response. That's not possible. I said, if you drop dead today and you have a massive heart attack, we are going to treat you with the same exact protocol, no matter where in the world you are. Because at that moment, I'm not trying to figure out why you're dying. I'm trying to figure out how to save you. And then I'll figure out the why later on when we get you back into that ICU bay. Right. And that's the difference that people are taking the approach. They want to figure out the why, or they want to figure out the whole how, when we don't have time for that right now. Right now, as I talk to you, every 38 minutes, a nurse gets assaulted. Every time, there's probably a school shooting going on right now today in our country. And I think that's where our priority needs to be. Our priority doesn't need to be about whose risk assessment is fucking better. I don't care. Like, what is going to get the best possible outcome for the best amount of people? Because that's where we need to spend our resources.
There's some that have such a high, and again, I measure it by return on investment. How much is it going to save the asset? Protecting the asset. How much is that going to save? And it doesn't matter. And also looking at the lawsuits. If we don't protect these kids, what happens? And you see in Uvalde again, the huge lawsuit. Same thing with Parkland. I mean, they left everything in that tower where the shootings went on. It's been there it only got knocked down 3 months ago. Since 2018, building has been sitting there, that 3-story annex of classrooms with blood on the floor, the kids' books where they dropped them that day, everything just like it was. 7 years later, they finally got the permission, got the budget to knock it down.
That's so terrible. I think there's so much money. I mean, there's so much money hemorrhaging out of this country. Like if you look at, and I'm grateful for the things that everybody's kind of doing now to uncover the truth, because it's like for people like us who have been in the back end of business or the back end of these departments and seen just the waste and the amount of, you and I both run our own bootstrapped companies, you know what I mean? So we understand what it's like to run a business and be able to do that functionally and have a good brand that you can rely on. But that doesn't take the billions of taxpayer dollars that we're spending in the wrong spaces. And I think it's going to take innovative people that aren't afraid to stand up and say, hey, I am not the status quo. I'm not part of them that continues to propagate this message so I can have my cush corporate life and go home. And
I don't even think it's a money. It's not even a money issue. It's that they don't want to know about it. People don't want to know.
Because that means they have to do something. They can't.
It means they have to do something, and it might.
Right.
It might hurt their feelings. I had one lady in training class tell me, no, I said, there's something to learn from every shooting, you know? She goes, well, when I see anything about shooting or violence, I just turn the page. I don't even read it. I mean, like, really? Why don't you
Yeah, I
just
mean, I think we've become so desensitized too as a nation.
yeah, dig a hole in the ground and stick your head in it, you know?
Right, and it's like,
Uh,
it doesn't matter until it happens to you, and for me, every single person that's listening to this right now, one day will be a patient. You will be at risk because of the things that are going on right now, and the violence is increasing because of the frustration, and that's kind of where I built the counterinsurgency manual. I use that as a reference guide to try and figure out where can we put all of these solutions together? Like, how do we actually build a format where everything talks to each other and everything integrates well enough to where we don't have comms issues because we eliminate.
that's right. That's right.
So I'm so encouraged to have you as a part of our team, as a part of our resource library. We will be featuring Miss Carolyn Ramsey-Hamilton on our new Tactbook app. That app is available for download for free for organizations to take a look, and you can actually directly message Miss Ramsey's company if you need help with threat assessments or you need help with getting access to any of that stuff. So we're really excited to that our partners are being able to bring that to us as a free resource. And something that we will be taking to, legislators and folks around the country as they look at resources to try to mitigate the violence in their communities. So
I think that's something else that we need to do too, is we need to go in these hospitals and talk to management, you know?
yes, yes. And they
Because
need the tools, and they're really
yeah,
busy running operations. So no one's expecting to expect someone to start a workplace violence committee and then become an expert on that is just absolutely ridiculous. Like
yeah.
that is unacceptable. And, I think that's something that, we'll probably talk about in a further podcast because I'd love to hear more about, specifics and we could talk about some case studies and some more information because I think that the more that we have these conversations, the more value that we can bring to people. And hopefully, it ends up saving someone's life.
Can I give you one more little quickie on risk assessment?
Yes, please do.
This is a great little story. So I was doing all of this big university, 17-story, have a hospital 17 stories tall. I'm doing the risk assessment. So the first thing is I go in and I notice in the behavioral health unit that they can walk right into the stairwell, right? And I said, this has
Okay.
got to be, they go, oh no, we have a door alarm. And I go, okay. So I walk up close, nothing happens. I walk closer, nothing happens. Bring me a ladder. So bring me a ladder, climb up the ladder. So the organization, the hospital decided not to waste money air conditioning the stairwells. So
So stupid.
it's so humid in there that when I went up and climbed the ladder and looked up, they did have a door alarm, but it was completely rusted over.
Oh my gosh. And it's like, how do they just let that go,
I know that, but they do because they're busy. It's a hospital and things are happening. And I'll give you another one from the same hospital. This was on the 5th floor. Go in there. Do you have panic alarms here at the nurse's station? "Oh, yeah, they're right here." Well, can I see them? So I got to crawl. You see why I wear pants when I go to these assessments. Crawl under the table on my hands and knees, look up to see where the panic alarms are, the silent alarms under the desk. There's nothing, absolutely nothing. You know why? Because they Formica countertops with beautiful granite. They just threw the demo boys just they
Yes.
threw the old counters away with the panic alarms. These people are sitting here thinking they have a panic alarm they can ring, and there's nobody else. There's nothing there.
Like the other problem is nobody uses it as a nurse because nothing ever gets done after you push it. Like, where does it really go? We don't have enough staff. If you got one officer for a 400 staff building, he's doing other things. So nobody even bothers using them because they're like, what difference does it make? And I think that's the portion of defining the culture of safety that's important, that you have experts, outside people to come and walk through your facility and it shouldn't feel completely punitive. It's not like Caroline and I are like, hey, you guys suck and you don't do
It's
your
not
job.
picking on anybody. It's helping them.
Right. Right.
It in every way. That's never my intent to talk down to anybody because of what they're not doing. But again, this is just awareness.
I think we need to start prioritizing it because, I definitely, as a charge nurse, or as a nursing supervisor, I mean, we check every code cart per shift. So there's no reason why it can't be done. It's just you have to involve your frontline staff in the process. If you want to look at them to make sure your egress and, ingress points and all of your access controls are working, then have the charge nurse, round on that. But also don't give her extra responsibilities while making her take on a 6-patient load. Like
No,
if
that's
you
right.
want your organization to be safe, you have to involve the proper people that can help you with that, but you also have to give them the time and the resources to do it. And I think that's the portion of ROI that people aren't looking at security from a revenue driver. And I think that's something that we're doing differently in the market is taking people like you, taking people, experts that can say, hey, I've got this product or this tool or this assessment that I do, and this is how much money it's going to make the organization, and then come to evaluation and taking that above the CEO to the board or to a VC funder that's looking to
It's a good idea.
it.
Taking it to the board is good too. Yeah.
Taking it to the
Yeah.
board to say, look, you might spend this money here, but if you're going to do a 5-year or 3-year or whatever strategic plan for safety, this is how much money you're going to save in the long run. And I think if you don't have clinicians at that conversation, you'll never understand the true dollar amount. You'll never understand the true profitability because you don't understand care.
Yeah. Yeah.
So, but I've loved having you on. This has been a dream of mine. I love you. I think you are an excellent resource, and I'm so excited that, we've connected and are looking at.
And I'm thrilled and honored to work with you too. I was really happy when we had our first conversation, because I like working with women to empower people. And I just think, like you said in the beginning, women have a unique, we know how important it is to take care of people. And I think women are gonna be able to advance this a lot when we get it out of the hands of the ex-military police, ex-officers.
I think I say this all the time. Innovation in healthcare has always occurred at the bedsides of our soldiers, sailors, and Marines. They were the ones that, we invented penicillin. Like there's so many things. The whole nursing model was invented during wartime. And so when I asked them for help, they came running. Like they literally, so I will speak very highly about them, but it is a different approach. Like they cannot have the same type of approach because you've got a different demographic and you've got a different mentality about what the goal is, the goal of the purpose of the organization. And ultimately, security is there to protect the brand of the organization, not
That's
just
right.
the assets
right.
and things that are inside of it.
And it's to protect their cash too, so they don't have to pay out a $10 million lawsuit where they have 18 victims and each victim gets $10 million. I mean, hospitals have closed because they've had a bad incident, and the payout is just more than they can afford. So if there's it's not just gee, we're waving the flag and it's a great idea. It makes financial sense. It builds in accountability, and that's what's needed, I think.
I love it. I love it. You are wonderful. Thank you for everything you've done for the industry. And on behalf of this younger generation of women in security, I'm incredibly grateful for the doors that you've opened for all of us. And I'm really pleased to have talked to you today. And if anybody wants to get in touch with you, how can they reach out to you?
They can reach out to me. They can look up my name, Caroline Ramsey-Hamilton on LinkedIn, or they can just email me at caroline@risk&A&D Security LLC.
Awesome. And I will put your information in the show notes. And as always, this will be available on YouTube, Spotify, and anywhere you get your podcast. So thank you so much for coming on Tactical Scrubs today, Carolyn.
Thank you, Mel. I appreciate the opportunity to get the word out.
You're welcome. Have a great day.
Okay, you too. Bye-bye. Bye, everybody.